right, and it's 12 o'clock. Welcome, everybody. Welcome to our virtual infection prevention train the trainer workshops for skilled nursing facility educators. Glad you're here. So in partnership with Health Services Advisory Group, the California Department of Public Health Healthcare Associated Infections Program presents today's workshop on infection prevention and control for environmental services staff, a train the trainer workshop for skilled nursing facility educators. I'm Sophie Frank, and I'm a health educator with Project First Line, and I'll be your host as well as a presenter today. So there are a few housekeeping reminders. This session is being recorded. We will post a recording as well as the slides from today's session on the Train the Trainer workshop resource page. If your name does not show up, we ask that you please right-click to rename yourself. This is how we are going to keep track of your attendance. If there are multiple people viewing, we're glad you're here, but we're hoping you can put your name in the chat so we make sure to count your attendance as well. So if you're logged in under one name, but there are multiple people viewing, just put those names in the chat so we can make sure to count you. We ask that you please stay muted if you are not speaking, but we do encourage you to type any questions or comments you may have into the chat or unmute during the discussion. We'll monitor the chat throughout the presentation and we'll address questions during the discussion. CEU are available for this workshop, so please stay for the entire presentation to be eligible. We'll go over how to claim your CEU at the end of the workshop. So this is a slide we present in all of our courses to make ourselves aware of implicit bias. Implicit bias describes how our unconscious attitudes or judgments can influence our thoughts, our decisions, or our actions. This includes involuntary and unintentional perceptions made without us even being aware, and occurs as our brains sort information and perceive data to understand the world. Our implicit biases can affect our decisions, which can contribute to societal disparities. In being self-aware about our own implicit biases, we can promote healthcare, diversity, and equality. So we welcome you to learn more about your own implicit bias at Project Implicit at the website listed here. And now I'm going to introduce our speakers for today. So I'm Sophie Frank, again, a health educator with Project First Line. I'm really glad to be here with you. And Aurora Avalos is one of our Project First Line nurse educators, and she's going to be talking through a lot of the content as our trainer today. So let's dive in a little bit. So with infection prevention and control, IPC is a collaborative effort, and EVS staff are an essential part of the IPC team and can serve as the first line of defense against germs. When all healthcare workers, including environmental services staff, work together to help create a safe environment for residents, we can prevent the spread of germs and protect residents. So EVS staff are not just cleaning, they are protecting residents. Previous and current outbreaks of multi-drug resistant organisms have been linked to poor adherence to appropriate environmental cleaning and disinfection. MDRO outbreaks can spread very quickly within and between resident sharing networks and put residents at risk. By following appropriate infection prevention and control practices, EVS staff play a really important role in reducing the amount of germs in the environment. For a building to stand strong, it needs a strong foundation. When thinking about infection prevention and control, EVS is definitely the foundation. Well-informed and trained EVS staff are important to have in your facility to have a strong IPC program. So the EVS curriculum was created in partnership with EVS staff and managers in order to gain insight into EVS staff training needs. This collaboration led to a curriculum specifically for EVS managers to train EVS staff. The overarching communication objective here is to have EVS staff understand their role in IPC. Each task is overseen by an EVS staff member is an opportunity to minimize infections. More specifically, the curriculum offers EVS staff-specific training that is retainable and accessible, tools for educators to provide simple, in-person, hands-on training, focus on EVS tasks, not just general IPC, adaptable to different learning styles, and opportunities for additional training and support. So let's kick it off here with a couple of poll questions. As the facility educator, how do you ensure that your EVS staff adhere to IPC practices? Select all that apply. A, provide education and training B, conduct adherence monitoring. C, provide feedback to EVS personnel. D, engage EVS to be part of the solution. E, all of the above. Or F, other, specify in the chat, please. So I'll give you some time to answer that. We really appreciate your participation and are excited to hear about how you adhere to IPC in your facilities. Awesome. We got about 60% participation. Maybe we can get a little more. Almost at 70. So close to 70. Come on, y'all. You got this. All right. We'll end the poll there then. Thank you. And we'll share the results. All right, so we have 67% participation, with the vast majority, 85%, saying that they engage in all of the above, and then the rest of them pretty evenly. So thank you so much for sharing your experiences there, and we'll go to the next question. Okay. So poll question number 2 asks, as the facility, what are your barriers to implementing training for EVS staff in your facility? So A, not sure where to start. B, lack of leadership support for EVS training. Not sure what training materials to use. D, time constraints or staff availability. And E, others, specify or share in the chat. So select all that apply, and we'd love to hear about, what are those barriers that prevent you from bringing IPC training to your team. All right, I think we can stop there and share the results. All right, so most people said time constraints or staff availability at 59%. And then not sure what training materials to use was the next, as well as lack of leadership support, not sure where to start. And I'm seeing some language barriers in the chat that people are really saying that's a major barrier. Okay, thank you so much for engaging with us. We're going to circle back to these barriers at the end of the presentation. So a note about today's workshop, we will be highlighting select slides from each of the 4 training modules or training topics from our curriculum. It is important to note that the actual module slide sets are much more robust and provide about 15 to 30 minutes worth of interactive training content with knowledge checks, video demonstrations, and each module contains additional curriculum files to help enhance your trainings. So in this workshop, we're going to use select slides as tools and tools as examples to demonstrate educational principles rather than train on the module topics themselves. We encourage you to review each module after today's workshop to become more familiar with the content. Today, as we go through each module, I'm going to demonstrate how you as an instructor can access the toolkit, curricula, and tools. We will provide ideas on how you can use this material in your training program. We know your days are always super busy, so we want to make sure that your teaching experience is as streamlined as possible. Let's dive in. All right, so we knew we wanted to enhance our EVS training. We also realized that in order to reach all EVS staff in California, we needed our facility educators at the local and corporate level involved in the training. So we developed the Infection Prevention and Control Training Toolkit and Implementation Guide for this purpose for educators to be guided through the process of planning and implementing an IPC training program for your staff. In the toolkit, we provide sample training schedules and explanation of training materials, the training materials themselves, and suggested instructor notes, as well as ideas for evaluating the training programs. So the toolkit and toolkit webpage will become available in mid-September, meaning that this presentation is a bit of a sneak preview. We hope you enjoy the sneak peek. The slides and recording from today's workshop will be posted to our Train the Trainer webpage at the conclusion of this week's workshop. For this presentation, I'll be walking us through accessing the toolkit through screenshots of the implementation guide, which is a PDF file. You can see the PDF toolkit table of contents here on the slide. Again, the file, the website, and all of the linked files that we're going to look at today will be available in mid-September. So if you go on our website Right now, they're not there quite yet, but they will be soon, and we will let you know as soon as they become available. So to access the slide set for Module 1, we're going to head to that section of the Project First Link EVS training. We'll either click on or scroll down to the Module 1 section of the toolkit on hand hygiene, which is the topic for Module 1. We'll look at for the curriculum slides and click to open the PDF file in a web browser window. Once the file is opened, you can choose to download the file or print it from the browser. Note that you will also have access to the presenter notes, which provide a suggested training script to go along with the slides. And now our trainer Aurora has a slide set for Module 1 and can give a presentation to her EVS staff.
Thank you so much, Sophie. So on Module 1 reviews hand hygiene. By the end of the presentation, your staff should be able to describe how hand hygiene helps stop the spread of germs, demonstrate proper hand hygiene, and adopt proper hand hygiene practices during environmental cleaning and disinfection. Module 1 also discusses how germs may spread and reviews reservoirs and pathways. Let's now look at a few of these slides, and I will demonstrate how you can present them to your staff. So germs need a place to live. We call these places reservoirs. Essentially, they are like habitats. Reservoirs can be in the human body, the skin, the digestive system or gut, the lungs, and airway, and the blood. Reservoirs can also be in the environment, like on sinks, medical devices, or bed rails. Germs frequently spread between and among these reservoirs. Understanding where germs live helps us recognize where there is a risk for them to be spread and why infection control actions work to stop them from spreading and making people sick. Germs need a pathway because they typically can move very far on their own. So germs need a pathway to get from where they live to another place or a person. There are a few common pathways for germs to be spread from reservoirs in healthcare. One is by touch. This usually involves the skin, especially the hands, but it also happens with devices which touch different people and surfaces. Another is when they are breathed in. And another is through splashes and sprays of blood, body fluid, or water from a sink or other source. Germs in those splashes or sprays can get into your eyes, your nose, or mouth, or into a cut or break in your skin and can cause infection. Anything that we do that involves touch, whether it's touching a person or things in the environment, like doorknobs or curtains, can be a risk for germs to spread. Germs also need to arrive at a new person. That person could be a resident or you or one of your colleagues. And in order to infect them, the germs need to get around the person's natural defenses. If the person is already sick, then their immune system could be weak and not be able to fight germs as well as a healthy person would. And if their skin is broken from having an IV inserted, for instance, germs can enter their body through the break in the skin defense. Throughout all of these elements, the germs need to survive in the environment if they are going to make someone sick. That's called being infectious. The infection prevention and control actions that you take at any of these points help keep germs from spreading and causing infection. Now we're going to use what we know about reservoirs, pathways, and how germs make people sick to discuss a scenario. Let's walk through one example to better understand how germs may spread. As an EVS staff member, you come in to clean a resident's room. You can see them, but you know that there are many germs in the surfaces and throughout the room. You are really busy today and you forget to clean your hands after you clean the first residence area. You then move to clean the second bed space in the room. You have now transmitted germs from the first bed space to the second bed space. And then the roommate gets sick. So that means that the germ moved from an environmental reservoir through a pathway to a body reservoir. As an EVS staff, you play an integral part to prevent the spread of infection. There are 5 key moments that will always require at least one method of hand hygiene. This is modeled by the World Health Organization's 5 moments for hand hygiene. So hand hygiene is required upon entering a resident room and before putting on gloves. Between dirty and clean tasks, for example, before placing items back on the cleaning cart, between cleaning residents' bed spaces that are in the same room, before touching clean items on an EVS cart. Note that when we going back to your cart after any task, we are moving between dirty and clean tasks. And this might be a signal that you need to clean your hands. And lastly, upon leaving a resident room and after removing your gloves. By performing hand hygiene during every one of these moments, you can reduce the spread of germs in your facility. Also, as you can see in this image, it will be a great visual reference tool for your staff so you can print it out and place it into a binder or make it into a poster for your staff to look at. Now that we know why hand hygiene is so important and when to perform it, let's look at this scenario and see where EVS staff could have prevented the spread of germs in a resident room. First, the EVS staff performs hand hygiene, enters the resident's room to clean, and then puts on gloves. They clean bed space number 1. After cleaning bed space 1, the EVS staff removes their gloves and puts a second pair of clean gloves. They go to clean residence number 2 bed space. Then they remove their gloves and then performs hand hygiene before leaving the residence room. Think about this situation. Where else should the EVS staff have performed hand hygiene? Okay, step number 3. Correct, that is correct. Right after the EVS staff touch items in residence 1's bed space and move to residence 2 bed space, they should have performed hand hygiene before donning clean gloves. Great answers. So when you remove, so something to remind our staff is that when they remove their dirty gloves after cleaning bed space 1, you contaminate your hands while removing the gloves. If you put clean gloves on contaminated hands, you have now spread germs to your new gloves. You might be thinking, but what if I didn't contaminate my hands while removing my gloves? Do I need to perform hand hygiene again? The answer is yes. It is very likely that you do contaminate your hands while removing your gloves, and there might be small tears in the gloves that you may not see and can allow germs to contaminate your hands. When you apply clean gloves over your contaminated hands, you contaminate your new gloves. Always perform hand hygiene before donning new gloves.
Awesome. So now let's go ahead and download one of the other files associated with Module 1 to enhance our training. So we'll download the activity cards and worksheets file for Module 1. We'll do that by going back to the Module 1 section of the PDF Toolkit, looking for the activity cards and worksheets file, and clicking the link to open. This will open the activities cards file for Module 1, Hand Hygiene.
Okay, so we designed these activities like recipe cards so you can pick one or more depending on how much time you have for training. The section outlined in green provides the amount of time it would take you to prepare and complete the activity. The section outlined in red provides the supplies you'll need to have and prep you'll need to do for this activity. It also has prompt questions to initiate discussion among staff, which you can see in the section highlighted in blue. Here's an example of an activity card called Pen Pals. You can use this activity card to reinforce hand hygiene concepts while visually demonstrating how easily germs can spread. To prepare for this activity, make sure that you have a bioluminescent product such as Glow Germ, a UV light, pens, a sign-in sheet, and hand wipes or access to hand wash station or sink. Once prepped, use the instruction section to go through each step of the activity with your staff. Let's now look a video showing an example of how this could be completed in a facility. In this video, you can see the supplies you need for the activity are prepped. Before the staff arrive for the training, apply a layer of fluorescent gel using a cotton swab on the pen. Make sure to get the gel on all sides of the pen and allow the gel to run translucent. You may also decide to use a clipboard for sign-in sheet and apply gel on the clipboard. You can ask staff to use the pen to sign in. Staff may or may not perform hand hygiene after they sign. Using the black light, you can then demonstrate how easily germs can spread. And if they perform hand hygiene between signing in and this moment, you can also show them how well they did in their hand hygiene technique. Any bioluminescent product will glow under UV light. So let's do a poll question. Will your staff participate in an activity like this? Yes, I see a lot of yeses. Thank you. And if you have done an activity like this with your staff, please share your experiences in the chat. Okay, we can go ahead and end the poll and share the results. So yes, 98% of you have done this activity in your facility. Thank you so much for participating.
All right, so that was Module 1, hand hygiene. Let's now dive into Module 2, which reviews disinfectants. To access resources for Module 2, we're going to navigate to the Module 2 section of the toolkit. I'll go to the curriculum slides and once again, click the link to open the slides in a web browser window. This will open the file on the toolkit website. Similarly to the last demonstration, you can download a digital copy of the presentation or print the slide set. So I'm also going to download another file associated with all the modules, which is a pre and post training questions file. So I'll open this for Module 2. Each module includes one of these and that comes with an answer key that facilitators can use to enhance staff learning. These are located right below the curriculum slides for each module. I'll click the link to open the PDF file in a new tab where I can download and print my pre and post training questions file. And lastly, I also want to download the activity files and worksheets, activities and worksheets file for this module. I'll navigate to that section of the toolkit to click the link and open the file. And now Trainer Aurora has all the materials she'll need to present for Module 2.
So before we review content, as a trainer, I want to gauge my staff's understanding at baseline. The pre and post training questions can also be used to evaluate the training program at at each facility. After I give my training, I'll provide the post-test, which tell us if there was a change in knowledge or if I need to train my staff. Note that using the pre and post-training questions as is would add an additional 5 to 10 minutes before and after each module. We suggest printing a copy of the pre and post training questions for each EVS staff to decrease potential test anxiety. Let them know that they are not going to be graded on their responses. Results of the pre and post test can help you determine which infection prevention and control concepts were well understood during the training session and which might need additional time for training. As you can see, that tests have a space for names, but answers may be collected anonymously if preferred. Make sure to provide the correct answers after the tests are administered. You may decide to review the questions and answers as a group after the training. Let's now review some of Module 2's content that you can present to your staff before going into more detail on post-test. So in Module 2, we review the difference between cleaning and disinfection. We talk about the different types of disinfectants and provide an extensive review of how to read a disinfectant label. In the instructor guide, there are additional activities to take a look at EVS closet, disinfectant storage, and best practices. Let's discuss disinfection and disinfectants. So disinfectants are chemical compounds that kill germs. Some examples include quartz, bleach, hydrogen peroxide. Your choice of disinfectant depends on the germ that you are trying to kill and the area or room you are disinfecting. Disinfectants are applied to objects such as bed rails, chairs, and other high-touch surfaces. All organic material and soil must be removed first by a cleaning product before applying a disinfectant, unless you are using a combined detergent disinfectant product that can do both clean and disinfect. Disinfectant selection is made by the environmental services and facility leadership, but it is your responsibility to know if the disinfectant is appropriate for that task, and you should be aware of the disinfectants that are available. Speak with your EVS manager if you are unsure what to do, how to use them, or if you have concerns about the disinfectants being used. Facilities select disinfectants that are Environmental Protection Agency or EPA registered and labeled for use in healthcare settings. The EPA regulates the use of chemicals to protect people and the environment from health risks. EPA registered disinfectants will typically have the hospital grade disinfectant written on the label. Disinfectants cannot work if cleaning doesn't happen first. If proper cleaning does not occur first, that dirt would act like an umbrella to protect the germs from being killed by the disinfectant. Always remember to thoroughly clean a surface or object before disinfecting to kill germs. Disinfectants are a lot like us. If you don't give it enough time to complete its job, it won't be able to kill the germs. The good news is that the amount of time each disinfectant takes to kill germs is written in the manufacturer's instructions for use. This is called contact or wet time. You have likely heard this term used in your facility. Contact or wet time is the amount of time required for a disinfectant to kill germs on a pre-cleaned surface. After applying disinfectant to the surface must remain wet long enough to kill the germs. So if you are using a disinfectant that the label lists a 10-minute contact time, the surface must stay wet for the entire 10 minutes to work. That could mean going back and re-wetting the surface to keep it wet for 10 minutes. When looking at how to read a disinfectant label, follow the manufacturer's instructions for use. If a product needs to be diluted with water, follow the instructions exactly. Estimating is not acceptable and can create a disinfectant that is too strong or too weak and can't do its job. Now that I have given my staff a pre-test and review Module 2 content, now is a good time to review answers with my staff. Here we see the answer key for the Module 2 Understanding Disinfectants Pre and Post Test. The correct answers are highlighted in yellow. You can go over these questions with individual staff or as a group and provide rationale. As you review with staff, you may refer back to key slides from the slide presentation to review IPC concepts. For instance, if your staff get question 2 wrong, which asks about what information you should look at when reading a disinfectant label, you can review the previous slide on how to read a disinfectant label to reinforce understanding. As you may remember, Sophie showed us how to download the activity file for Module 2. For Module 2, there are 3 activities worksheets available. Let's look at the middle worksheet in more detail. Picture this. What to look for in an EVS closet is an engaging activity that you can provide in worksheet format or complete using your own facility closet to gauge a staff's understanding of proper and improper EVS closet practices. As with the previous activity, picture this activity card provides materials, timing, and instructions. After reviewing Module 2's curriculum, you can provide this activity to staff to complete individually or in groups. Alternatively, you can present this on the screen during a formal presentation or print out to review like in a huddle setting. After providing the staff with this worksheet, have them take turns finding aspects of the closet that could be improved. Make sure to ask your staff what's wrong with or missing from this closet, why is this wrong, and how will you correct this? If the staff answers correctly or incorrectly, engage in discussion around rationale and refer to the training modules as needed. It is important to note that all worksheets come with an answer key and provide rationale to support understanding. So let's do a chat question. What do you often see in the EVS closet that shouldn't be there? And how do you correct for incorrect practices? Please share your responses or experiences in the chat. Okay, personal items, personal belongings, drinks, food, shoes. Thank you for your participation. Let's now move to Module 3.
All right. So next up is Module 3, which covers setting up an EVS cart. To access the Module 3 resources, just as before, we're going to scroll down to Module 3 section in the Toolkit. We'll once again navigate to the slide set and click to open the slide file in a new browser window. Again, once the file has opened in a new tab, you can choose to download it or print it for your presentation. Again, I'm going to access the activity cards for Module 3, and as we'll be using this file later. And now that she has the resources she needs, Aurora is ready to present to her EVS staff.
Okay, so in Module 3, we review the steps for setting up a cart for safety, efficiency, and convenience, including how to properly identify products and materials used for cleaning and disinfection. We also discuss how to clean and disinfect reusable equipment after use. In the corresponding instructor guide, there are activities to identify appropriate and inappropriate ways to set up a cart. Let's now look at a few of these slides, and I will demonstrate how you can present them to your staff. When setting up a cart, consider safety, efficiency, and convenience. By knowing how to set up your cart, you will be familiar with the products and tools used for cleaning a resident room, and you'll be able to find what you need when you need it. You'll easily see what items, including residence room supplies, need to be restocked on your cart. For example, you might consider dedicating a toilet brush for each resident room and bathroom, especially a resident on contact isolation. Staying organized means you save time and you are more efficient with your cleaning process. You won't need to spend time looking for particular products or tools to use. Staying organized means you save time and you are more efficient with your cleaning process. Knowing how to safely use the products on your cart means that you will clean to the best of your ability and follow manufacturers' guidelines. Note that you should never touch your cart and equipment with contaminated gloves. Always clean your hands and change your gloves before touching clean items on your cart. All of these efforts will help you limit the opportunities for cross-contamination. So here, this is an example of a cart setup, and your facility carts may be different. Let's briefly review some steps for setting up a cart, starting with the top of the cart as denoted here with the orange arrow. So for the top, you can add your alcohol-based hand rub and soap refills, any required PPE, and any resident room supplies like paper products, which might include toilet paper, paper towels, or tissues. You can set this up, these items anywhere on your cart as long as you have them available. When you're setting up your cart, again, think about safety, convenience, and efficiency. Having your alcohol-based hand rub accessible at the top of your cart will make it easy for you to perform hand hygiene at all of the appropriate moments, like between glove changes. And again, your cart should never store any personal items like water bottles or food, and avoid eating or snacking during cleaning for your own safety. The slide set reviews in more detail what cleaning items and other equipment should be included in the front deck or outside of the cart, as denoted here by the orange arrow. Again, the slide set reviews in more detail what items and cleaning equipment could be included in the cart, inside the cart, as denoted here by the orange arrow. Environmental cleaning supplies and equipment quickly become contaminated during their use. Regularly clean all reusable items after use. This helps reduce bioburden or germ buildup and helps to avoid germ transmission. Thoroughly clean, disinfect, and rinse equipment such as buckets and solution containers and store them upside down to allow for complete drying. This helps to prevent germ growth, ensure that mop hands and microfiber cloths are clean and dry before use. Clean and disinfect all reusable supplies and equipment in a designated area that is not used for other purposes. The EVS manager should have access to the reusable equipment and carts so they can assess equipment before use. Cleaning reusable equipment should occur at the end of each shift. This includes removing dirty mop heads and soil microfibers, cleaning cloths for laundry, making sure that you clean all items according to the manufacturer's instructions, and following your facility's policy for cleaning the EVS cart and closet. In this slide, you will review some best practices for setting up a cart. So you can go over to make sure that your staff is stock enough microfiber cleaning cloths so they can be changed when soiled, to make sure that they have a separate clean and soil items, that they have a, a, a reference list of high-touch surfaces on your cart to make sure that they know all the required contact and wet times for all of the disinfectants that they use, and have a lockable compartment stored in a designated EVS area. Now that we have reviewed some Module 3 content slides on setting up a cart, here's the activity cards for Module 3 that you can access in the facility, in the activity file. As you remember, we downloaded the activity file for this module as well. Let's look at the activity card Spotted and walk through it. As you can see, it has the title of the activity, the purpose, the prep time, and materials and instructions you'll need to do for this activity. So just by looking at the spotted activity card, can you identify the incorrect EVS card practices? Okay, I see a cleaning bottle on the bed, food, open chemicals, bleach on the bed, cleaning bottle on the floor. Correct. Thank you for participating. Let's now see a brief video. So for more hands-on activity, and if timing permits, select and prepare a facility EVS card and stage incorrect EVS card practices. As the facility educator, you can ask your staff what should and should not be on the card. Just like in the slide presentation, review the contents on the top of the card, the front deck, or inside the card. This demonstration is especially useful for training new staff to quickly identify if their cart is set up correctly. Keeping a list of high-touch surfaces with images on the cart is a best practice and can serve as a reminder for your staff.
All right, so our instructor Aurora has done a great job of providing a training to her EVS staff, and now she wants to engage them further in a peer-to-peer discussion on cart storage. To do this, she can use the instructor checklist, which is linked below the pre and post training questions file for each module, as you can see here on the screen. I'll access the instructor checklist for module 3 by navigating to that section of the toolkit, finding the file, and clicking to open. The file will, as usual, open in a new browser window, and from here you can print or download the file to use for your training.
So this is the instructor guide for Module 3 on setting up an EVS cart. The blue box highlights instructions for usage and includes ideas for hands-on activity to apply what was learned in the presentation. The orange box has the contents or topics. You can select one or more topics and go over with your staff. As Sophie mentioned, I want to review cart storage with my staff. Here is the cart storage. As you may, let's walk through it. Let's walk through this instructor checklist. The left section of the instructor checklist includes a topic and suggested discussion prompts. On the right includes the corresponding rationale by topic. For this example, you can walk through the facility with your staff when applicable and go over the check boxes. You can ask a staff, how and where do you store your cart after use? Allow them to respond, and then you can provide the rationale if they need further understanding. So let's do a poll question. When is a good time to keep food or beverages on the EVS cart? Select all that applies. A, on Halloween. B, for your coworker's birthday. C, when a resident's family member brings you a coffee. D, when it's really hot outside. E, your car should never store any personal items. Thank you so much for participating. I'll pause for a few more seconds. Okay, a few more. Okay, we can go ahead and end the poll and share the results. Yes. So as you can see here, 99% said yes, your car should never store any personal items like food or beverage. Thank you so much for participating.
I like that one. Okay, so let's move to Module 4 on cleaning and disinfecting a resident room. As you may have guessed by now, to access the slides, you can navigate to that module section of the toolkit, find the slides, and click the link to open the file. I'm also going to download the activity cards and worksheets file as we have before from the toolkit for Module 4 so we can use them later.
All right, so in Module 4, we review the cleaning and disinfection process, walking through a standard cleaning process, a daily versus a terminal clean, and how to use workplace reminder like an environmental cleaning checklist to make the job easier to navigate. The corresponding instructor guide has suggestions for activities to identify high-touch surfaces and to put the cleaning and disinfection steps in order. So this is an animated slide, and you can ask your staff to engage them. You can say, where can you find the highest concentration of germs in a resident room? And you can pause for a little bit and allow them to give you some answers. And then you can click to display where the germs are. And as you can see here, the highest amount of germs in a resident room will be on and around the bed. And you will also find germs on door handles, light switches, walkers, and many other places. These are referred to as high-touch surfaces. So these are examples of a standard cleaning process. We should always move from clean areas to dirty areas. For example, begin with the common surfaces before moving to the resident area. And restrooms should always be clean last. It is also best to work around the room in the same direction every time. Clean from high to low surfaces, top to bottom. For example, you can clean the bed rails before cleaning the bed legs, or high touch surfaces before the floors. Establish a pattern and follow a standard cleaning process to ensure consistency in cleaning and to prevent cross-contamination. Here's a visual representation of cleaning a resident room. The arrows shows you the general direction of cleaning. We start by cleaning shared equipment and common surfaces like doorknobs or light switches, then move to items touched during resident care like bed rails or tray tables. And lastly, we'll clean around the direct resident area, the bed itself. By following this pattern, we prevent spreading germs from a dirty area to a less dirty area or clean area. And with this slide, we review how to clean a single bedroom. We can start by asking our staff, what will you do first to prepare for cleaning this room? And then you will review with them to ensure that they have all the supplies that they're going to need to clean that room, to make sure that they have the wet floor sign, and to note that if there are any challenges to safe cleaning, such a resident currently present in the room, or a resident on isolation precautions, or if there is a need for additional supplies or PPE due to spills or other obstacles, it is important to remind them that if there is any damage or broken furniture, to report it to management. And also if they notice that there are some items that may get in the way of cleaning, encourage them to do the best they can to move things around and organize so they can clean. But note that this is usually done by nursing staff. So communicate with your supervisor if you regularly come across items that get in the way of cleaning, and work with your nursing staff to move certain items. So before we begin to clean the room, we're gonna perform hand hygiene. We're gonna put on gloves and enter the room. And here you can ask them, decide if you should go clockwise or counterclockwise. Remember, we generally want to move from clean to dirty. In this room, we'll go clockwise so that we move from the cleanest to the dirtiest parts of the room. We'll start with the light switch, the alcohol-based hand rub dispenser, the closet, the chairs, and the wall on the left. There might be a TV or whiteboards here too. Remember to go from top to bottom, then clean the window sill. This can generally be done with one cleaning cloth. Then you will remove your gloves, perform hand hygiene, and put on a clean pair of gloves, and change your cleaning cloth before moving to the bed area. Here you will start with items like the overhead lights, nightstand, overbed table. Remember, we want to move from top to bottom and then move to the IV pole if they have one, or a call button or TV remote, and then the bed frame, which is in direct contact with the resident. Lastly, you'll move to the bathroom. Even though this is a single resident room, you would remove your gloves, perform hand hygiene, and put on a clean pair of gloves before moving to the bathroom, because you would likely go back to your car to get your cleaning supplies. As you will start with the sink area, you clean the mirrors, the paper towel dispenser, the soap dispenser, the faucet and handles, the lip of the sink, and then the bowl of the sink last. Then you will move to the toilet. You clean the handrail or grab bar, the toilet roller holder, the toilet flusher, the toilet seat, and then the toilet. Then you'll leave the resident room and remove your gloves outside of the room and perform hand hygiene. The slide set reviews the cleaning process of a two-bed room. Many of you may be familiar with an environmental cleaning checklist, which is also included in the toolkit. This can be used to identify any gaps and improve adherence to the cleaning process. So here are the worksheets for Module 4, found in the activity cards and worksheets file that we downloaded earlier. That what will you do worksheet includes an answer key and corresponds to a set of what will you do activity slides. This activity is also included at the end of Module 4. So let's give this activity a try now. As mentioned, it will provide you with the instructions. So what we will do is read the cleaning and disinfecting example statement and think about if you would or would not do the practice based on the training. You will have them raise their hands as quickly as possible to answer the question and raise others. And then you will provide the answer and the rationale. So question number 1, will you work around the room in the same direction every time while cleaning? You will pause and allow them to add their answers. Okay, I see some yeses. Okay, let's go ahead and see the answer. Yes, it is best to work around the room in the same direction every time to establish a pattern and follow a standard cleaning process to ensure consistency in cleaning and to prevent cross-contamination. Let's try question 2. Will you clean from clean areas to dirty? Yes, I see a lot of yeses. Thank you for participating. Okay, let's go to the answer. Correct. We should always move from clean areas to dirty areas. For example, you begin with the common surfaces before moving to the resident area. And remember that restrooms should always be clean last. Okay, let's do one last question. Will you clean from high surfaces to low and top to bottom? Yes. Yes, I see a lot of yeses. Thank you. Thank you for participating. Let's go to the answer. Correct. So clean from high to low surfaces, top to bottom. For example, you can clean the bed rails before the bed legs or high touch surfaces before the floor. And so for this activity, there are many more examples you can review with your staff. You can even make it like a friendly competition of who can get the most answers, questions correct. Okay, we did it. We looked at all of the modules and toolkit resources. We talked about ways to incorporate IPC trainings in your facility. Now let's talk about addressing some barriers to provide IPC training to your EVS staff. As you recall, we asked you about these barriers to training at the beginning of the workshop. Let's review each potential barrier in more detail. If you are unsure where to start, this workshop is a good place. Hopefully you picked up some ideas of how to train your staff on IPC practices. You can enlist other leaders. Remember, this is a team effort, and you can work with your leadership or IPC champion from nursing or physical therapy or the activities team. There are two of us today sharing this information with you. Was it a dynamic experience? Maybe you can do something similar in your facility. You can start small. You can train one module at a time. And lastly, know your audience. Who are you training? Consider their level of understanding. Consider their learning or language preferences. If there is a lack of leadership support for training, think of easy ways to involve leadership. You can ask them what their barriers might be to the training. You know, it can be financial or other barriers. Or you can also give them an opportunity to be part of the training. Maybe ask them to be a trainer or designate them as an IPC champion. If you are unsure of what training materials to use, consider using the training shares today. Use the EVS Toolkit. And if you have encountered time constraints or a staff availability is an issue, provide the trainings over time. Maybe review one topic each month. You can decide to use select slides instructor checklist items, or activities based on your staff training needs. You can train as part of a new hire or annual orientation, and you can train anywhere, anytime during daily huddle or training day.
All right, so thank you for all of that, Aurora. And now we're going to wrap up a little bit here. We just want to remind you that as the instructor, you do not need to have all of the answers. Collaborating with and learning from your staff is a great practice and an ongoing effort. We encourage you to work with your staff to find solutions and provide possible solutions to barriers. Our program is also here to help navigate the material. Project First Line is also thinking about engaging EVS staff beyond trainings. We'd like to record trainings and post them as online self-guided modules, post office hours with interactive activities as we have done for our CNA audience, offer follow-up support and ongoing infection prevention dialogue, for example, developing messaging and activities to send to EVS managers on a quarterly basis to use in your facilities. We may also develop some social media messaging. And then, of course, we have a dedicated ask box for Project First Line for EVS staff and managers to provide comments and questions on an ongoing basis. And that's listed right there on this slide. We look forward to hearing your experience with this toolkit and hope that you will let us know how we can best support you moving forward. I know language barriers were brought up, and that's something we hear a lot, and I'm glad you guys are bringing that up. We're hoping to have the EVS toolkit released in Spanish coming soon. I'm not sure of an exact time, but that is in the works, and so we hear you there. All right. So we're gonna finally wrap up with a poll question here. Tell us, after today's workshop, how do you feel comfortable navigating the toolkit to implement IPC training for your EVS staff? Select all that apply. A, yes, I am ready to train my EVS staff. B, yes, but I need more time to review the toolkit. C, yes, but I need more time to review EVS IPC concepts. D, no, this is not for me. E, others, share any details in the chat. All right, I think we can bump up a little more participation. I believe in you guys. We're only at 46 right now. Can we get to 60 maybe? What do you think? Ooh, 50. Here we go. Is it Thursday or what? All right. It's 52, 53. All right, we can wrap up and end the poll there and share the results. And we're seeing that most are ready, or all of you are ready. That's great, with maybe some caveats of needing time to review the toolkit or to review IPC practices. That's great. Thank you so much for participating in this poll question and in the presentation generally.